story and stories.
Oh, excuse me. Sorry
It's
about
okay.
that.
That's okay. And stories of others. And and I'm also a strong advocate. So I seen something that was going on with, we're in California, so we have Caltrans. They're the agency that has oversees the areas along the freeways in different areas. And law enforcement there is delegated to the California Highway Patrol. Well, in our areas, the sheriff's department was coming in and just being ruthless and arresting people, and I knew that that was not part of the protocol. And so I onboarded a really, really strong advocate lawyer up here in his law group, and we went in. They went in and came down and interviewed people, and we got that to change. So there, we got policy, we achieved policy reform, and now the CHP goes in, and if sheriffs do want to go on that piece of property, they have to go with CHP. So then now there's like a little bit of oversight on that, and so being having a voice, you can change. You can change systems, and you can get policy reform done for the rights of your patients, and just arming your patients with their rights. Letting them know what the rights are. Their due process rights. You can record. I always encourage my patients to record every interaction that they have, not video but audio. And it'd be good if you say, "I'm recording this for your protection and for mine," when they encounter law enforcement, and just know that they have rights. I mean, they don't. I didn't know I had rights when I was out there. I bowed down to the law enforcement and anybody that walked up to us. I felt like I was a nobody, but there's rights. And our patients have rights, and they need to be able to. They need to learn them, and they need to be empowered to use them. During times when there's sleeps and things like that. Because right now, in the current landscape, obviously, the criminalization is like the top priority, it seems like. And so with the rights, you can fight back. So that's another thing that I'm strong on, very strong on.
Thank you so much. I think that's really interesting how you mentioned encouraging your patients to
Mm-hmm.
record. I think that we talk a lot about lived testimonies and like verbalizing them, but I think it's having that video evidence and having those like video recordings is also a really great way to kind of share our lived experiences.
Mm-hmm.
So thank you for that. That was very empowering and important to hear. So the next question that we're going to get into is to you, what does meaningful inclusion of people with lived experience of homelessness in advocacy spaces look like? Obviously, a big part about sharing our stories is that we're uplifting the voices of our marginalized communities. But to you, how do we approach this so that we're appropriately uplifting them and giving them the space that they deserve in our advocacy?
And well, within that type of realm, I mean, really, actually, when you go down and encounter your clients, wherever they may be at, where they live, or if you can on the street, or even in a clinic, and you talk to them, take time to hold space for them. Take time to hold space so that they can tell you what's going on and what they would like to see. Just listen. Listening is a strong suit. They need to talk. They want to talk. They want to tell. Once you get that trust built, they want to be able to have an outlet. Because when you're in camp and you're on the streets, your street family, they're there for you and they're strong. But if you tell someone something, it's going to go all around camp. So if you want to, if you really have something on your mind, or the patient has something on his mind, hold space. They don't want any kind of feedback. They just want to be able to talk, and that's really powerful because and then they acknowledge that I hear you, and then maybe if they want suggestion, if not, say okay, next time we meet, let's talk about some alternatives, or let's talk about some choices. Always do a person-centered approach to street outreach and what they want. It's not what we want for them, it's what they want for themselves, and that empowers them right there. And they take control of their care and what they want, and with that you can empower them. I always go down with printed out with a sheet of rights that they have. This is our rights. You have a right to do this and this and this and this. And recording, like I said, is huge because that way law enforcement and whoever else talks to them has to be. They have to act, the way they're supposed to act. They can't act any other way because you're recording, and it intimidates them and it makes them angry. But that's your right. So I mean, huge rights. And inclusion of homeless into anything is important. Lived experience is important, or still living in the experience is important. Even like on city meetings, committees, and things like that. When there's a board of supervisor or a city meeting, I always encourage my tribe to go to that and speak up, be a voice. That's including them in decisions. You have to, this day and age, lived experience is huge because it's needed to form and shape new programs, tell the governance what works, what doesn't work, how you can make shelters better, how you can make street medicine better, what you need as far as medical down where you're at. Having lived experience individuals in any realm of government or any realm of community contact is paramount. It's needed because they'll make laws, and they'll make different decisions based on paper and pen and no input. But when lived experience individuals start talking, then they can start building programs and healthcare around what they need on the streets and different things like that. And that's huge because there's a lot of things that don't work that they're pouring money into that we're like, we don't need that. And if we don't speak up, they're not going to know. So that's how inclusion is huge, and that's it's very important. Plus, it connects community, I think, and it connects healthcare. It connects the street teams to each other, to the patients. It connects everybody in a way that is needed instead of just generic on paper. When you tell someone your story, and you build that trust and engagement, it's a connection. And connection is what we need.
Thank you. And I completely agree with that. And I
Mm-hmm.
think what you said about making sure that people with lived experiences are present at these
Mm-hmm.
city council meetings, at these places where people that make laws, make decisions, are really going through that process of formulating their next steps. I think that's so important to consider. And I think that that's made all the difference when you look at policies that have actually been effective versus policies that have not. It's seeing that difference between how much lived experience they actually listen to and how much they actually incorporate. So for our next question, I wanted to ask you a little bit about the language that homeless healthcare advocates should be using. Are there any, phrases, any framing of issues or themes within homeless healthcare that we should be using, or any that we should avoid when we think about writing our own op-eds and sharing our own stories?
Right. Language is huge. I mean, language is huge, and that's a good question. So within the homeless healthcare advocating world, I mean, when I was at the FQHC as a CHW, I had advocate voice. I've always had it, but I had to kind of tone it down to be within the realm of their compliance, and I understood, and I didn't want to get anybody in trouble. And so the language I had to use was very minimal compared to what I use now when having my own nonprofit. Because there's a lot of different things that you can say that will cross the line, even in advocacy if you're underneath an umbrella. But just speaking out, and make sure that if you are working for an FQHC or any kind of type of um, hospital or whatever, when you go out or when you talk to people, actually, should I say, when you talk to people, just make sure you know their organizational parameters so you don't go past it. But language will make a positive impact. Words have power, obviously. Words have power, and there's no doubt about that. And all you need, basically, when I advocate and I speak, I include the plain and simple truth. That's what I speak. I don't put anything on it, put anything more on it. Plain and simple truth about how sleeps kill. Less funding will mean more deaths on the streets, and say, and healthcare is a basic human right. That should be honored. I just put that out there, and I'm assertive. I'm not aggressive, but I'm assertive, and just facts. Use facts and nothing more than that, because it can't be disputed or sanctioned if you speak actual facts. And advocating is huge for your patients. They need it. They need your voice to be included, and they will respect you, and they will that empowers them to want to talk too. Um, Currently, there's so much silence from healthcare advocates speaking due to the current, like I said, like witch hunt agenda to cut funding for homeless programs and things like that. And language that includes political bias should never be used, obviously. But attacking or calling out the system in an aggressive manner will get you nowhere. So that's what I would say when you do speak to whoever it is, or you speak to this, on behalf of your patients, when you speak to stakeholders or in a meeting or a board of supervisors, just the simple truth, it needs to be said, what sleeps are doing to people, and what we need more funding. And basically, you can't go wrong with that. Words have power, like I said. There's not really any language I wouldn't use, except for, of course, being too aggressive. Obviously, they're not going to listen to that. But that's how I do my advocacy. I am assertive, very assertive, and I mean, I don't, you have to be assertive, and you have to stand on facts, and you have to be continuous until you get somewhere with it. Whatever that may be, or people engage with you.
Thank you. And I think that's a very important thing, that to be assertive, and
Hmm.
especially in this political climate, it's
Yes.
who else if not us? So I think that's a really good point. And also the fact
Right.
you mentioned about using our facts because they're undisputable. And the same thing with like our lived experiences. You can't dispute those.
Hmm.
Those aren't political, they're what we've lived through. Um, and I think that's a really special part about telling our stories in general. So thank you for your answer. And so we have one more question, at least on my end. And if our audience could take any specific action, what would you recommend them to do?
Take any specific action. Just I would recommend them to, right now, currently, with the sweeps and the criminalization, everything, people are losing, our patients. And so, just like I said, holding space is huge, and also just empowering them. Just be there for them. And when you see them struggling, just don't give them false hope. Don't promise them something that you can't follow through with, but just let them know that you agree, you see what's happening, and you're trying. You have people are behind them. It's not just them against the world. There are many people behind them and trying to advocate for them. And it's going to take time, but I would just suggest, that's what I would say to the up and coming street medicine teams that are trying to be built and things. When you engage with your patients, for one, always have someone, it will not always, but it's a very good idea to have someone on your team with lived experience. And usually it's a community health outreach worker, like it was me, because we were able to go into encampment, and we either already have that trust built because we know the people, or we're able to walk in there and know how to introduce ourselves as strangers, because people will hide these days. People, they see someone coming, they will hide because of the current situation, the criminalization. So I would definitely suggest people have lived experience on board, and just be authentic. Be authentic with yourselves when you go into an encampment, talk to people, and always, when you talk to people, don't stand over them. Just go down and bend, like lean down into them, or sit on something, or even with them. So when you talk to them, you're face to face, not standing over them. That makes it a servant. It's called a servant's position, where you are equal to them, and they will let you know what's, they will talk a lot more, and they will engage a lot more. And that's important too, because that's the way you get to, for one, get their healthcare and their needs taken care of, and for two, you build relationship. And relationships, when you build them with your patients, that is the utmost respect right there. And you can empower them. Empowerment is huge. They need to be empowered, and it's up to us to do that for our patients, because that will save lives too.
Thank you so much. I think that's such an important point, to just get involved with your street medicine community, or your street medicine community, talk to people, get to hear their voices, and so we can make sure that these important voices in society are being amplified and being heard. So I'd say that's a really important point, and thank you so much for making that. So that's all the questions that I have
Mhm.
right now. Thank you, Melissa, for sharing your incredibly inspiring story as well as your guidance. I know I felt very inspired and moved, and I'm sure our audience did as well. So with that being said, now that we've heard kind of a little bit about Melissa's story and what she's done with her advocacy, I wanted to give everyone on this audience, in this call, the audience, a chance to potentially share their own story. So in the next couple of weeks slash months, we're going to be launching our Project Op-Ed. So this is where we're all going to share our stories in to create collective change. So, if you're interested in potentially creating an op-ed, submitting an op-ed, we would love if you guys could fill out our op-ed interest form. This is going to help us gauge some interest, kind of see where we're at in writing an op-ed. We're going to be hosting op-ed hours. We're going to be hosting an op-ed workshop. So if you guys are interested in making your stories heard, amplifying the voices of those who are currently marginalized in society, this is going to be an amazing opportunity. So I'm just going to leave this out for a moment. You guys can scan the QR code. I'll be dropping also the link to our one pager in the chat soon, so that link will be included as well. But there's many more details to come, but this is just a little sneak peek. And most of all, I hope that we all feel inspired, we feel empowered, and we can really see how sharing our lived experiences in homelessness can be one of the most important tools that we have to create change in street medicine. So I'm just going to open up the floor to any questions we have from the audience, any thoughts, any reactions that anybody wants to share. Feel free to unmute yourselves or drop it in the chat. And yeah.
Thank you, Melissa, was someone else going? Sorry. Thank you, Melissa, for sharing your story. I have a quick question. As someone who I haven't really gotten involved in advocacy that much, but want to. But at first I want to learn more before I start doing things. I was wondering if you had any like book recommendations or just general recommendations for education regarding advocacy surrounding homelessness that you'd recommend me read first before getting involved?
All right. Well, I don't have any book references right now, but the Street Medicine Institute we're working on an advocacy kit, and there is a webinar that Caitlin Schwan has done on the site regarding advocacy. She also, if you just look her up, she was the special rapporteur to the United Nations before she joined the Street Medicine down in USC, and she represented human rights, and a lot of that is has to do with vulnerable populations, especially the unhoused. And she's got a lot of great advocacy advice. She's basically my mentor in advocacy. But yeah, I just grassroots groups too. Grassroots groups are all amazing. There's grassroots groups everywhere. I actually have found I co-founded one in 2020, and it's still going strong. It's not a nonprofit, but it's still going strong, and we kind of work together. And they were recognized by the city also. So grassroots groups is a great place to find advocacy. Just experience and to learn. And advocacy, it sounds like a big word, but it's not that. It's not really it's not that hard. You just learn, you go and learn and listen to the people that you're representing, and you just use your voice in social media, in board of supervisor meetings, and anywhere that you can to speak up to highlight this vulnerable population and what's needed and what's going bad and what's being their rights are abused and what can be solutions, and then you just go forward from there, and people will kind of like almost like being a magnet. They'll start getting a group together. It's amazing. Advocacy is just so powerful and amazing. I love I have an advocate spirit, so I can't say I mean, yeah, that's definitely Street Medicine Institute. We're putting out some more things on advocacy upcoming, so definitely that's a good place to go.
Thank you.
I have a question too. I was just kind of wondering if when we're trying to, like we're going out and learning from people with lived experiences, but then also hopefully trying to give them good opportunities to connect them with like the actual city officials who are going to be making decisions about their policies and stuff like that. For example, I'm from Albuquerque, New Mexico, and so it's definitely been coming up a lot in Albuquerque of just constant discussions around the sweeps policies and stuff like that of what can we also do to kind of if we're saying like hey like what you have to say about your experience is really really valuable and it's important for other people to hear it and you should come to this meeting or you should come to this like official city proceeding. What can we do to kind of facilitate making that experience and stepping into that space kind of still feel like a safe space for people who are then we're then asking them to be really vulnerable about their personal experiences, if that makes sense as a question. Sorry.
It totally makes sense. Totally makes sense. And there's going to be a lot of people that that won't go, that are hesitant to go because, for one, they don't want to be. Maybe they feel that they're not speaking, or they're timid. They don't want to be seen. But the people that do, there's a lot of people in the camps, on the streets, your patients that do want to have a voice. And if you pose it to them like, I will go with you, let's go to this meeting, let's go to the here, and if you want to talk, raise your hand. If you don't, that's fine, but just listen in. I will talk, I can be your voice too. Bring them to the meetings, let them see that it's not that intimidating, let them see that other people will speak up too. And that's a way to engage them, because going and having your voice, like talking in front of people, a lot of people are terrified of that, which is understandable. I didn't know I could do it until I started doing it. I never thought about it. I'm like, oh. And then the first couple of times I spoke, I was like, can I do this? And it came out so easy because I speak from what I experience. It's not like you're trying to, write you up from a script or anything. I improv. And a lot of people out there don't realize they have that talent, or that they don't realize that they have that courage in them until they're brought to some place and they actually speak up, just even for a couple sentences at like a board meeting. To let them know, if you want them to be, if you want to be heard, just go up there and just tell them what what you want to get across. You don't have to have it perfect. You can stumble, you can stutter, it doesn't matter. And once they've experienced that empowerment, they'll either, if they choose to go forward, they'll empower them, or they'll be like, I'm never doing that again. They're terrifying, which is fine. But you can be a voice for them. But include them, bring them, encourage them to come with you, come with your team, or whatever, to the next whatever it is that's meeting, and watch what happens. They have to see what happens, and also storytelling is also a great way to get their voices heard. Like we were doing at libraries and universities and stuff. Just invite the public, and they can be there too, and you connect that way. And also social media. Social media is a great place to start for them. For telling your patients to start on social media, go on social media, and just introduce yourself. And you're going to get a lot of feedback, and you got a lot of pushback, but it's not going to be in person in your face. So you can temper how you respond. There's many ways to introduce them, but it's hard. It's hard to get them to even see that they have value. Sometimes, after they've been moved around and shuffled around, all this stuff thrown away, and so once they find that empowerment, they'll thrive from it.
Thank you so much.
You're welcome.
Another question, but I don't want to hog if someone else says the question. Okay, I'm just gonna go for it. So you mentioned criminalization of homelessness as being a very important advocacy issue right now. Mm-hmm. What other issues within advocacy do you think are like the most important for us, other than criminalization?
Being a street medicine team, what we've been doing, what I've started doing, reasonable accommodations. So when you find a upcoming sweep, and there are people in there that are disabled in the encampments, start doing reasonable accommodation forms for them, and file it with the city, the county, whoever has that authority over that piece of property. It may or may not stop the sweeps, but at least you have a paper trail of people, within that. You filed something on it. This person in this camp, or this camp has quite a few disabled people. They have the ADA law trumps. Let me not say Trump. ADA law is over what the administration is doing right now. ADA law is serious law, and ACLU will pick that up if it's too much of if it's violated constantly. And so reasonable accommodations show there are disabled people. They need whatever you're asking for, like either they need more time to move their belongings, that you postpone the sweep, or we need to find a place for this person to go, because this person cannot go back anywhere else. You can't just make a move because, let's say, he's in a wheelchair, what have you. So it would be devastating to him. It would be harmful to him physically. He could even die from this, being moved around. We need to let the authorities and the cities, counties, and whoever's doing the sweeps, let them know that, look, you're killing people. And this is why there's disabled people in this camp, and they're disabled. They can't just pick up and move. And so once you start, we've been doing that in the Bay Area. So once you start doing that, it paves the way for a temporary restraining order or an injunction on sweeps so we can figure things out, and possibly litigation too. As a way to fight back against sweeps instead of just yelling about rights and stuff. Actually, doing something like reasonable accommodations forums is a great way to actually build a paper trail and start doing something further.
Thank you.
I have a question as well. First, I want to say thank you. This was a really impactful session. And I also want to ask, you had mentioned briefly using social media for advocacy. Could you like speak more to how you've done that?
I started off, it's not for everybody because there's some haters, but I started off on Nextdoor for our area. And Nextdoor there's quite a few people in there that are very, very much not happy with me. They'll instantly hit you, but just be consistent. But social media, such as Nextdoor or different, like even letters to the editor in your local paper. Letters to editor is a great way to do it. Also, that way you don't have to be hit back with the instant hate, and just get your story out there and go to your. I would suggest also going to your local library or or going to your council member or whatever. See if you can have a town hall, and maybe build with other groups, other grassroots groups, other street medicine teams in the area, or just other service providers, and build something and have a small meet and greet at our town hall, and just nothing formal. And that's ways. That's not necessarily social media. That's in person, but that's a great way also to engage the community. Because what you want to do with social media and advocacy is engage the community. So Nextdoor is a great place actually because you're putting it out there. You're talking about it. People are talking. Like, you're going to get a lot of pushback and a lot of NIMBYs, a lot of probably a lot of hate too. But there are people on there that actually do, argue with those other people because they do realize that we need to help our unhoused patients, and so you get a mix of people. But at least it's being talked about. At least it's not just under the table now anymore or under the rug. You're showing people that there are other people out there that are suffering on the streets, whether they want to talk down about them or support them is being talked about, and we need to keep talking about it and keeping it front and foremost, or else nothing's going to happen. It's just going to keep happening over and over again. Mm-hmm.
Thank you.
Mm-hmm.
Alrighty. Any other questions, any other thoughts from our audience? If not, then I guess that concludes our first webinar. Thank you so much again to Melissa. We really appreciated having you and for sharing your story. And thank you to our audience for listening and for asking some amazing questions. And yeah, I hope everyone has a great rest of your night.
Yeah, thank you for having me on here. It's been great, and thank you very much for giving me a voice.
Of course, it's our pleasure.